Out. All right. So for the recording, this is the meeting of the Board of Health of February 19th, 2025. We have 4 board members present, myself, Catherine Hilton, Wim Levine, Arlene Reed, and Garrett Simonson. And we do not have very much on our agenda tonight. I spoke to Wim briefly about this. You all received a letter of complaint that that came to the Board of Health. However, that letter was not received in time to get on the agenda.
I see. I wondered about that.
We won't be discussing that tonight, but I'll put it on the agenda for next time.
Next time. Okay.
With whatever other town input might have been received by them. So I would like your approval of the minutes of last meeting and the minutes of December 4th, because we voted on the minutes of December 18th, which were absolutely perfect because we didn't have a meeting on December 18th. So will you please transfer your vote for the minutes of December 18th to the minutes of December 4th?
So move for both.
Second.
Any objections? All right, let's consider them both approved. Garrett, you're kind of rolling your eyes there.
I just, it's funny that we mixed up the date.
We didn't mix up the date. I mixed up the date. Because really December 4th was a very long time ago, especially given my impaired memory.
But we should all be mindful of what we're voting on. So,
well, yeah, right.
Should have spoken up.
Right. It would have been good if somebody had caught me, but right. Nobody did. Except for the matter that we're not going to discuss, I do not have too much. Did you all receive the notice from MAHB of the workshops that they do, the all-day workshop?
I don't think I did.
Okay, they are actually doing one of those programs on April 26th in Northampton, which is just about unheard of. And I'll send it around to everybody. DEP or DPHM1. Anyway, the state will pay the registration fee, and even if they didn't, the board would pay it if anybody wants to go. Usually they are. Well, but April 26th, I bet again that's going to be on town meeting. It's the second year in a row that we have had the local one during our town meeting. I swear, one of these years I'm gonna not join them again.
Oh, right, 26th.
Right, last Saturday in April. So never mind, I won't even bother to send it to you.
Yeah, okay.
But it's
too bad. I was kind of thinking I might even go.
It's valid feedback to them that they schedule it at a time that typically is around town meeting time for a lot of communities.
Yeah. Yeah, that's a good point.
April, May timeframe.
Okay, I'll send them a note saying that they've done this to us 2 years in a row. And apparently it's pretty much the same program that they did last year. So, yeah.
What is the topic?
It's kind of everything. Let me find it and read it to you, if I can. Topics will include legal authority of boards of health, hearings, orders, and enforcement, governance, open meeting, public record requests, disruption, a deep dive into the effects of SafePoint 2.0 on local boards of health. That one might have been interesting. Case studies in tobacco, cannabis, and synthetics, opioid settlement updates, environmental case studies, nuisances, noisome trade citing, litigation updates, and important decisions from the Supreme Judicial Court, and more. So, I mean, a fair amount of that stuff does not really affect us. And a lot of that stuff we already know or have been doing for a long time. So it's probably not a disaster that we're not able to attend.
Okay.
So is there anything that y'all want me to know? Yes, ma'am.
So I have a couple of updates regarding Maven and in turn our website. And Pat, I think you're sort of aware of some of this. But anyway, I am in the process of reestablishing my lapsed access to Maven. I completed a training and I am awaiting the word back from them, which may take a few days. But in order to do that, first of all, I needed to change my email address that I use for town business because it needed to be formatted including your name and your community, your town or your organization. So my email address for board related issues is now arlene.reed@shutesbury.org. And Arlene is spelled Arleen. And Reed is spelled Read. So
Shutesbury Public Health or
public health at shutesbury.org is no longer in use, although any email that comes to it, for now anyway, is going to be forwarded to my new email address.
Okay, so I will, so you want your communications from the Board of Health to go to this new?
Yes, please.
Okay.
Yeah. But if you make an error or you're responding to an old email or something that, where you hit reply, it will get to me. But better to use arlene.reed at shutesbury.org. So Gail Fleischacker, who accomplished this change of email for me, pointed out that because I asked her to change it on the website, that the Board of Health webpage, she said, by the way, the pandemic information that you've got up on that webpage is really out of date. And she was right, boy.
Yeah, I looked at it.
There are a bunch of dead end links and whatnot. So I have some recommendations, I guess, about what we should do about that. Mostly.
Wait, before you get to them,
Yeah.
let's ask the bigger question. Do we need a pandemic page?
Well, I don't know that we need a page that is called the pandemic information because it may be still wise to have some links for information about what to do if you are sick with respiratory illness, just general, the broader topic of respiratory illnesses and keeping yourself apart from others, but mostly linking straight to DPH's advisory on that so that it becomes more DPH's task to keep their page up to date. And it would then, it would be current if people follow that link. But I don't know, what do you think about, do we need anything at all in this regard, or can we eliminate that page?
Well, I'm going to look at it right now and see.
If you allow me to share my screen, I have it up. Is that, well, I guess I can. The button is green, so I think I can. So hold on. Oh, I can request. I can request it.
Okay, and I'll allow.
Okay. So let's see if this works.
Okay.
All right, so you see it. So this is if you go to the Board of Health page,
Mhm.
there is this for information on coronavirus, go to the pandemic. What is this? I have a little window here that I'm getting rid of. Okay. So when I click on this, all this stuff in red and yellow and multicolors is no longer there is no longer any sort of mandatory isolation period and mandatory masking period. And
Okay.
so that's really obsolete. And by no means are people required to report a positive home test. They're welcome to be in touch if they have questions. So maybe a rewording of that. This is a dead end link, this Vax Finder, if
Okay.
I'm not mistaken. It
Yeah.
goes to a bad gateway. And then the CDC information has all been archived and you just hit a dead end there. But DPH information Mass DPH is still up there and it is more broadly stated about a variety of respiratory illnesses, flu, COVID, RSV. And so it's an overview type of thing. And I don't think it would be a bad idea to keep a link like that.
Okay, here's my thought.
Go ahead. Yep.
Can you go back to the Board of Health page?
Yes, I can. Yep. Up or leave it right here or go up.
No, go to back to the town website,
Oh,
Page.
Board of Health page.
Board of Health
The
page.
pandemic
Okay.
page. There you go. So my thought is we could get rid of that banner, or we could put something, instead of having a separate page for this, we
Mhm.
could have somehow, could you scroll down a little bit, like below
Mhm.
Sarah? Right, between Sarah and announcements, perhaps. Ooh, some of those probably should go. Both of them should go. Oops. We could have just a large header that says, for information about respiratory disease, click here.
Mhm.
And it'll go straight to that DPH
Sure.
link
I
that
agree.
you had, and we'll just have that one line. I don't think we need a lot of
Yep.
stuff, unless
That makes sense.
you have some other stuff you want to say.
No, I think there might have been one other thing. All this is dead right here.
Okay.
And but there is but even back on Mass DPH's site, there is that itself contains a link for finding a testing site or finding any number of vaccination programs. So
Mhm.
mostly it's, I think, linking to Mass DPH and welcoming people if they have questions to either contact, ideally, their healthcare provider.
Mhm.
If they don't have a healthcare provider, they can't reach them. They can try to reach out to me. I am not in a position to give medical advice in this role, but only public health related
Mhm.
advice, things about staying home and finding a test site. So probably reaching out, contacting me is not going to get them any farther than the links that we can put up. So,
Okay. Okay. We can say if you have questions and put your
ideally contact your healthcare provider.
uh-huh.
But if you have other questions, you can contact me.
Okay. And is it better to contact you than, say, to contact Sarah, or better to contact Sarah?
Oh, Sarah is maybe better, but I know Sarah isn't there. She's tied up with other locations. She's only with us Mondays and Wednesdays, right? So,
Right, but
but
presumably she answers her
yeah,
email
likewise. Yeah.
whenever.
So you're right. Maybe she should be first.
Okay. Okay.
Yeah,
Um,
I'm in favor of linking to the DPH page, and for the time being, not linking to federal pages.
I
Yeah,
totally agree.
the federal pages are dead anyway,
Mhm.
I think.
Or maybe not even there. So,
Right.
Right.
And another big public health issue comes up, we can create a new page. It's not like that goes away.
Exactly.
So,
Right. Yeah, we can
Okay.
always have new pages.
All right, if I stop sharing, or does someone need this page still up?
No, that's fine. I'll work on this tomorrow and I'll be in touch with you to make sure I got everything the way you wanted it.
Okay, perfect. Thanks.
I'm not sure I can take the banner off, but if not, I'll ask Gail to do it for us.
Yeah. Okay. Thank you.
Okay, so I'll do that. All right. Are there more things that we should be talking about?
I don't have anything.
I have been going through some old files. A lot of the stuff that I brought back from the district last year or more than a year ago. It was kind of lying around the office in crates. And Gabe gave us a little push to clean things up. And I'm finding all, interesting old things, some interesting old correspondence and stuff that I will share with you at an appropriate moment. And it's not going to happen. It's probably not going to happen this month, but maybe next month, maybe by the end of next month. Our files are going to be pristine. I mean, we have really good filing. And once I get all this backlog either into it or thrown away, because there's a lot of duplicates and there's a lot of non-essential stuff that we're not required to keep, then things are going to be a lot more tight and easy to look at. I learned that I haven't actually seen the list of the required documents and their retention requirements. Some of them, I mean, there are some things that apparently you have to keep forever and some things that you keep for 7 years and blah, blah. But if you want to throw away any of that stuff that has expired, you have to get permission from the state. You actually have to send an email describing your documents and saying that you want to throw them away.
Mm.
So, however, that doesn't include anything that there's a copy of elsewhere, that there's sort of a required copy. So whenever I turn in, for example, I turn in checks to the treasurer for a collection, and that comes with a little cover sheet that describes, the checks and who wrote them and how much and what they're for. But then they keep a copy of that. Right, so we don't have to. So I like to keep a few years, but I'm not going to keep, because sometimes it's helpful to look back and say, well, yes, you did pay that fee, or maybe I don't have any record of you're ever paying that fee. So I don't even have to keep those. So we can really pare down. Now, Arlene, do you know what's the story about actual medical records? Because, with those flu clinics, we have records of that. Do you know how long that stuff has to be kept?
I want to say 7 years, but
that was always the standard.
that was the standard, but because we have no electronic record of those from those flu clinics, right?
Right.
Yeah. So I think 7 years has been the standard.
Mm-hmm.
I can't
Okay, well, I'll find out.
swear to that,
But I'm guessing that, and we probably haven't had a flu clinic for 7 years.
no, I don't think we have.
And in fact, did I tell you this before, that Gail got a shredder? Gabe, I keep calling her Gail. Gabe got us a shredder that's in the copy room, and or not a shredder, she got us a sort of roll-off container that goes directly to the shredder, and it's locked, so we can put confidential things in there without having to shred them ourselves.
Good.
So I will look into that. I can't think of anything else that we would necessarily need to talk about.
Good.
So how about we adjourn? Hearing no objection, I'm going to go ahead and declare the meeting over.
Okay.
Lovely to see you all.
You
Yes.
too.
And
Have a
good night.
night.
See you soon.
Stay warm.
Okay.
Yeah, good luck, Wim.
Yeah,
Thank
good
you.
luck, Wayne.
Bye.
Bye.